Hi, my name is Jessica Berry and I'm the Five Towns team leader.
And I'm Heather Harford and I'm the Castleford Adult Treatment Team Leader. I'm just going to talk to you today about the services that Turning Point Inspiring Recovery provide across the Wakefield district.
So firstly, who are we? Turning Point is a leading social enterprise providing health and social care services across England, supporting people to improve their health and well-being. We employ 4,500 people in over 300 locations across England. 93% of our services are CQC rated as good or outstanding. In our latest annual review, Turning Point had supported almost 68,000 people with drug or alcohol issues over the last year. We have a long established relationship with Wakefield and have been delivering services in the area for over 35 years. And we work in partnership with multiple stakeholders, which underpins our approach to treatment and recovery.
So this slide is just a snapshot of some of the teams we have across the district. We have some adult treatment teams in the Wakefield, Castleford and South East areas. Also the Five Towns team that covers some of the more isolated pockets in the district. We've got the alcohol target team, the criminal justice and non-opiate and outreach teams, and we also have a shared care team, but we'll talk some more about those later on in the slideshow. We've got the Get Connected team that provides our aftercare service, so they deliver a variety of groups and activities to support relapse prevention. The Out There Everywhere team, which includes some specialist workers, including community outreach workers. We have Inspiring Futures, which is our young persons service, so they see individuals up to the age of 25. We have the Inspiring Families team that provide families and carers support to loved ones of those using substances. And they do hidden harm work with children as well. And we also have a clinical team that works across the entire district, across all teams, providing our clinical services, wellbeing services and prescribing.
So here is a visual of the various core hubs we operate from across the district. We're hoping to expand this further over the next year, improving accessibility for service users as much as we can.
So as mentioned, we have the core hubs, but we also have satellite services in various areas across the district to increase accessibility for service users and reduce barriers wherever possible. So as you can see there, we work from some churches, some GP surgeries, and we've recently secured some satellite bases in Normanton and Featherstone and hoping to expand into Streethouse, Crofton and Charleston areas over the coming year.
So like we've mentioned already, we do a lot of partnership working. So part of the reason we do it is to help engage service users. We spend time in local partnership organisations in the area, allowing for easier access. This improves engagement into service and helps build and develop local networks to support service users in treatment. To complement this, we have specialist workers such as an isolated communities worker, outreach workers, safeguarding leads and a senior mental health practitioner.
We also work from various organisations on a regular basis, co-working to support mutual service users. So we spend a lot of time at the Community Awareness Programme in Wakefield. We work with Riverside Housing at Marsh Way in Wakefield and with Royal Sovereign in Normanton in partnership with the Housing Needs Service. We also work closely with probation, with Saviour's Trust housing provider in Pontefract and from various family hubs across the district. Again, just increasing accessibility for our service users.
So the different models of delivery that we can offer. So we've got clinical interventions, which are completed by our clinical team, clinical pilots and pathways, wellbeing assessments that are completed by our wellbeing nurses, community detoxification, inpatient detox and residential rehab, models of psychosocial intervention, group work programs, online and face-to-face. We've got a specialist alcohol target team, a specialist non-opiate team, the shared care provision, which we'll discuss later, specific criminal justice team managing prison discharges and court orders, specialist posts including Tier 4 services, isolated communities, outreach, as well as needle exchange and pharmacy liaison. We have a harm reduction approach. We offer the 5-step intervention for family and carers and resilience building with our hidden harm team.
We have a group work programme that we offer to all of our service users, dependent on what treatment pathway they're on and where they are in their recovery journey. So it's a mixture of face-to-face groups and online sessions, again, just increasing accessibility and reducing barriers so that people can access treatment no matter what their circumstances. If people aren't able to attend the groups, we also have a digital platform called My Turning Point, where service users can access the group work programmes in their own time and from their own devices.
Some of the group work options that we offer. So we do the recovery skills program, which is regarding building the recovery capital. That's a 12-week program. We've got your moving forwards, which is preparing for detox from opiate substitute therapy. We have reclaim, which is for your stimulant users. ARC, which is for non-dependent alcohol users. MAP for dependent alcohol users, and your alcohol abstinence group.
As Jess has already mentioned, harm reduction underpins everything we do, and we offer needle exchange services across the district. So it means that people can safely dispose of their used equipment and also be provided with new injecting equipment. We know that people are going to inject, and we'd like to make sure that they do it as safely as possible with the right equipment and with the right advice. We also test for bloodborne viruses, so hepatitis and HIV, and liaise with primary care to help people access treatment should they test positive for any of those. The needle exchange workers also signpost people to services for further support if that's what's needed. And we also commission a number of pharmacy-based needle exchanges throughout the district where people can access this same support if the offices aren't open.
So shared care that we've already mentioned a few times is a provision where service users can access treatment and be seen by the recovery worker in their local GP practices. This is for local partnerships of services and agencies who work together to deliver care for substance misusers, and it allows collaborative work with primary care. So the benefits are that service users with complex care needs can have these met in one place. Similarly, service users that are stable in treatment can be seen in the community rather than having to come into service. Recovery workers can work collaboratively with primary care to advocate the needs of the service user and provide specialist information to inform practices.
So again, as also mentioned, we've got our criminal justice team. So this is focused on supporting individuals who have been through one of the criminal justice pathways. So it might be that they've been given a court order, a drug rehabilitation requirement, or an alcohol treatment requirement. It might be that they've been released from prison, or it might be that they've been given a community resolution order. So we have specialist workers that support these individuals through treatment, working closely with probation, closely with prisons. So we do report to probation if needed and help these service users engage if they're on probation. Continuity of care is ensuring that prison leavers are supported and they have a smooth transition of care upon release from prison. And for those on community resolution orders, we assess and enrol these people onto group work programmes. And this is for people who have been given orders for possession of controlled drugs. So we work alongside the police and the courts, minimises the strain on court time and diverts these individuals from the court process.
So going into some of the treatments for our opiate users, so there's a range of different medications that we have available to us that we can prescribe from our clinical team. This is in order to aid in the detox of heroin or other opiates. So we have Phiseptone, which is also known as methadone. Phiseptone is the green liquid that's taken daily. Esprinol, which is buprenorphine. It's the wafer that's taken sublingually, which basically means on top of the tongue, and that's every day. Buvidal, which is a buprenorphine prolonged release injection. It's administered as a weekly or monthly injection. And naltrexone, that's a tablet that's prescribed after completing detox treatment, and it is an opiate antagonist, which means it's a blocker for opiates.
We also issue naloxone or Nixoid to our service users and those using the needle exchange. It's used for the partial reversal of respiratory depression following an opiate overdose, and it is a life-saving medication. So we ensure that everybody in service is offered this for free. We also give safe storage boxes for medication and educate and train service users on how to use this life-saving medication and how to store medication safely as part of our harm reduction approach.
So for wellbeing support, like we mentioned earlier, we've got wellbeing nurses as part of our clinical team. So they offer various interventions to support service users, including wellbeing screenings, mental health screenings, blood tests, liaison with GP surgeries, referring to local support services, liaison pathway with hospitals should a service user be admitted to hospital. As mentioned earlier in the presentation, we also have an Inspiring Families team. So that consists of 2 workers that can provide home-based family and carer support. So for that, they place the family at the core of service delivery. This is family members of people of those that have been affected by substance use. We do a task centred with detailed action plans, smart outcomes with regular reviews. We do a holistic approach and flexible approach that are tailored to each person's circumstances. We prioritise the safety and wellbeing of children and young people, and we ensure that we're reliable and non-judgmental. We also have access to the family line, which the details are below, which is a third-party service.
Safeguarding is something that we take very seriously here at Inspiring Recovery. We have 2 named safeguarding leads, but we also have safeguarding champions within each team and team leaders who all take a structured and proactive role in our work. We have a local safeguarding pathway, which includes safeguarding processes, escalation processes should we have safeguarding concerns, and also any specialist pathways, as you can see below. As a service, we also attend various local safeguarding meetings, as well as representing our service users at social services meetings. We've also got a specialist social worker seconded in post should we need any support and advice.
So working in partnership, we do a lot of multi-agency working. Again, it's part of the core of what we do. So we've delivered services in Wakefield for over 35 years. We're committed to partnership working. We have clear pathways with partner agencies. We have attendance at multi-agency meetings, delivery of training to partner agencies, service level agreements in place, coordinate joint care planning or signposting where appropriate, and referral to family and carers provision when identified.
So how to get support for yourself or for someone that you know that might require our services. You can phone us on the 0300 number and do a self-referral or refer somebody else, and we'll then try to contact them. You can refer yourself online, or you can also complete a professional referral online. Just go to our website and follow the link.
Thank you so much for taking the time to listen. As you can see below, we've got the links to all of our social media, our website, our phone number and email, and our address. If you have any questions, please don't hesitate to get in contact with us, and we appreciate for you listening. Thank you.